Hi, my name is Dave Ryder, and I want to talk to you today about that aching neck pain and your envelope of range of motion. If you learn what I'm about to teach you, you're going to be able to increase your range of motion, you're going to be able to prevent losing your range of motion, and you're going to be able to get your normal range of motion back and increase your envelope of range of motion, reduce triggering muscle spasms, reduce unnecessary aches and pains in your neck. You're going to be able to flush metabolic products from the joints, prevent injury, inflammation, irritation, increase hydration and circulation, and getting all the parts working together. My name is Dave Ryder. I'm a success coach, I'm a human behavioral specialist, and a mind-body work integration therapist. All right, and that is the connection between the mind and the mind-body connection and how they work together. Have you ever heard that motion is lotion? That is exactly true. Motion is lotion. The more we move our joints and body, the more we move our limbs and our joints, the more we lubricate the tissues around the joints, keeping friction down and at the same time preventing a whole host of other issues. So let me tell you a little bit about your envelope of range of motion. As we get older, as we grow older in age, we transition and we gradually go from complex movements to stability. Complex movements, as you recall, being a child, a kid in grade school, out on the playground, wrestling, playing, falling constantly, the very complex movements, to eventually, decades later, moving to stability, right? And going from activities, again, like playing, wrestling, dancing, to these habituated movements of sitting, standing, and moving forward. All right, so our envelope is our envelope of range of motion is set and maintained by our daily routine or repetitive movements that we do on a daily basis. All right, and if the majority of my movements are or consist of sitting, standing, and moving forward, then that's my envelope of range of motion. And if I have a narrow envelope of range of motion, then I run the risk of being triggered or injured, perhaps, when I experience unexpected movements that take me beyond that envelope of range of motion. All right, so what takes me beyond my envelope are unexpected movements. For example, if it's icy outside and one day I go out and I unexpectedly slip and I try to prevent falling and my arms jerk out to brace myself or to break my fall, my arms are being taken outside of my normal envelope or range of motion, and I'm more susceptible to injury or irritating something. All right, so here are 6 steps that you can do to increase your or develop your envelope of range of motion and prevent injury. Okay, step 1 is pick a body part. So for this example, let's take the neck, the cervical area, this neck here between my head and my shoulders. All right, and this is great for anyone that's experiencing a sore neck. Okay, but before we move on, I want to make sure that you check this out with your doctor first. Make sure that movements are okay for you to do. And of course, if you've ever had any injury or accident with your neck, make sure you see a qualified professional first before you do any of this. Number 1, most importantly, to take responsibility for your own health and use common sense. Okay, and do not move into pain. If it's painful, just back off a little bit. Do not push it. Okay, so step 2, number 1 is to pick the body. We're going to work with the neck today. Okay, number 2 is check your range of motion and compare it to what's considered normal range of motion. All right, and if you have less than what's considered normal range of motion, then you can set a goal and begin to get that back. Number 3, step 3 is to repeat these movements with your head. There are 4 basic movements to begin with. All right, and that's rotation, that's rotating my head, side bending or lateral flexion, then flexion and extension. All right, 4 basic planes of motion. So repeat those motions. All right, and number 4 is to don't push it. Movement into pain always slows down progress. And okay, so let your body acclimate. Let your body be patient and let your body do its job. All right, so what you're doing, in other words, you're asking your body to acclimate to your movements. And it will, depending on that, it'll expand that envelope instead of contracting it. You want it to expand, and that takes a little bit of time. All right, so don't push into the pain. It just go as far as you can comfortably, and you'll get much faster and better results. All right, number 5 is for each plane of motion, repeat the movement 25 times to each side. That's rotation to 25 times. Rotate, right? 25 times to each side. That's 25 times this way and 25 times this way. All right, and then side bending. Side bending 25 times this way and 25 times this way. And then we've got flexion, which is you try to touch your chin down to your chest, right? 25 times. And extension, 25 times. All right. Now, before you do this, I want you to know what normal range of motion is for each one of these movements. All right. So for rotation, it's 80 degrees. Right. About 80 degrees is normal range of motion. So, for example, if you only have 25 degrees range of motion, not a big deal. It's just where you're at. You know, and you don't want to push it. Don't push into pain. Don't force it, because again, if you force it, you're going to slow down progress. Just go as far as you can comfortably, and every day do that 25 times. Take full range of motion, whatever that is. Go as far as you can, and after a while, your body's going to start to acclimate, and it's going to expand that envelope of range of motion, and you'll get that more. You'll go from 25, 30 degrees, 35, 40, 45, 50, you know, all the way to 80 degrees. You probably get that full range of motion back. Maybe you won't, but you'll certainly increase that range of motion. All right, but that means the muscles have to acclimate, the fascia has to acclimate. When you're rotating, you're actually moving the joints, and you're breaking up metabolic products like calcium and things like that. All right, if it hurts, don't do it. Back off. All right, and just allow your body to make the adjustments over time. Okay, so for side bending, right? Side bending is about 40 degrees. That's normal. So if you don't have 40, if you only have 25. Then just do that 25 degrees every day, 25 times to both sides, right? And that'll start to increase over time. And you're increasing that envelope range of motion. Guess what? Then you can watch that movie with your head like this, and you're not going to wake up, oh, with that tremendous neck pain or that strain, probably. You know, most often that's what happens is we watch something, you know, and I'll get to that in a second. All right, flexion. Normal range of motion for flexion is about 45 degrees. Okay, extension is about 85 degrees. All right, you never want to go beyond 75 or 85 degrees, because you want to protect the neurovascular structures behind the head, and that's where we have these neurovascular structures. We don't want to compress that stuff. It's very dangerous. Don't do that. Do not go beyond 85 degrees. It's not an exercise to see how far you can go. You just want to use that range of motion. All right, just about 85 degrees. Okay. So it's always better to be to err on the side of being conservative for extension. All right, and lastly, step 6 is to be consistent every day. And after a couple of weeks, you're going to notice some improvement. All right. Now let's think about it for a minute. How often do you actually rotate your head side to side? Right? How often do you bring your chin over to your shoulder, unless you're looking behind you in the car, checking to make sure it's safe to change lanes? Probably not very often. Probably only when you're driving, right? So as you can imagine, if you're not using this range of motion, that envelope gets smaller and we lose our range of motion over time. All right, and if you've ever sat and watched a movie in a funny position, or if you've slept in your bed and you had a pillow that was the wrong size, you know, maybe you slept like this with a huge pillow under your neck, and then you woke up and it was horrible neck pain. Like it's called a neck crick, you know, or something, some muscle spasming, and you got lactic acid burning in your neck, you know, of the discs, and all the tissues get really irritated and inflamed. All right, that's an envelope problem. All right, you took your neck outside of your normal envelope of range of motion, and the muscles probably started to spasm as a result and create some inflammatory things that developed. Okay, so your envelope of range of motion gets smaller over the years if we don't use our full range of motion regularly. So the take home here is to just move. All right, it's not, now exercising and stretching is also very important, but we're not covering that today. It's just movement. If we don't use our full range of motion regularly, all right, then we run into problems. So that's how we get it back, and that's how to prevent losing what we have. All right, so what you've just learned were 6 simple steps, or a 6-step process to prevent neck pain, to prevent losing your range of motion, regaining the range of motion that you've lost, and keeping your joints lubricated and hydrated and flushed, and how to maintain your neck for the rest of your life. Simple, efficient, and effective. One more time, I just want to make sure that you get your doctor's permission before you try these movements, and if you have ever had a neck injury, make sure to see a qualified professional that can evaluate these movements, that these movements are safe for you. All right, and if everything works out, you'll be able to repeat these simple movements and prevent injury, increase your range or your envelope of range of motion, slowly progress to more complex movements that are more fun, like dancing and things like that. All right, and just go as far as you can without any pain. And until next time, take care of that neck, take care of yourself, and thanks for watching.